Yes, you're welcome once again on our episode of reproductive health problems or concern. I'm the host, Bisoboka Tonny, as usual, and I've come back with another good topic. As we talked about the parts or the systems of the body, as we indicated in the first anatomy of the body in the first episode, now we're back again with a reproductive health. But majorly we're going to talk about on the concerns or the major problems of the reproductive health. The major concern of the reproductive systems or the problem that affect the reproductive system in general, we have them in female. I would start with we have what we call endometritis, and then we have STDs or the UTIs. We have what we call gynecological cancer. We have what we call HIV/AIDS. We have what we call sex violence or violences to young girls, and also we have what we call cystitis in female. And with male also we have a problem of cystitis. We have a problem of cancer whereby we have what we call prostate cancer. We have a problem of testosterone getting problems in it, and then also STDs and UTIs. So in general, bringing up those problems to you, I want us to start picking a leaf from each and every problem. We're going to start with the problem of endometritis, whereby there is that thick layer that grows on the uterus. That thick layer that normally grows, at times it might grow in another part. It can grow behind the uterus, it can grow in the fallopian tube, it can grow in the ovary or behind it, affecting it. So whenever there is that problem, a woman tends to have problems like failure to conceive. They tend to get a problem of PID. They tend to get a problem of pain in their messes when there is a heavy bleeding, also which is a problem leading to hemorrhage. So that topic majorly, it's a problem. Now we have also a problem that I'm trying to explain in details. We have a problem of HIV/AIDS. As we know that people affected with the HIV virus, they tend to get other acquired diseases, the AIDS or the disease syndromes, which tend to affect them. For example, the warts that also tend to affect the reproductive systems, majorly like the vagina and the so-called. So with that, on taking the medication, also you tend to get other problems or the side effects. So in simple terms, HIV/AIDS also is a problem to our reproductive health. Those people taking now like into the male system, if you keep on taking on too much drugs or the HIV, the antiviral drugs, people tend to lose their libido, what we call the manpower, to some drugs that the combinations that have a side effect to our manhood. So people taking it, so you should know that also HIV/AIDS has an effect on our reproductive systems or part. Now the third problem of cystitis is when the bladder or the urinary bladder is affected. Whenever you get a problem of that due to infection, and then your bladder fails to contain urine, that's when we have what we call urine incompetence, that you cannot support or you cannot hold urine for a long period of time. As a result of cystitis, your bladder cannot contain urine for a long period. It's a problem. So it results from so many problems, also from the infection, from problems, accidents, surgeries, a lot. So we tend to advise people to take caution of their urinary bladder. You have to take caution from the accidents. You have to be careful on the medications that you take. You have to be cautious on the safe sex that you have. So, because it is a major problem that can end up damaging your reproductive health. And also we have a problem of gynecological cancer. We have different types of cancer that can come into our reproductive health. We have what we call cervical cancer. We have a uterine cancer. We have cancer that affects the ovary. So all those are problems of the reproductive health. So we should be keen of what we take, smoking, different medication that we use like vaginally in a proper way. We have the other things that like some examinations like the x-ray and what all that we do. So they tend to affect us, and also they tend to affect the reproductive system. We have also major problems that tend to affect majorly the female reproductive system. Those are the fibroids, the cysts, and the myomas. They tend to affect the uterus majorly with ladies. Those who have been using other contraceptives like the family planning methods, they tend to get fibroids. Those taking most of the pills, like monthly pills, the swallowed pills, they affect, and then you get problems. And some medications also taking long time without conceiving. You reach at the age of 35 without conceiving, automatically the uterus, which is made of having a baby, it will create its own things so that it can contain to feel that it is pregnant. So those fibroids, cysts, myomas, they are also major problems of the reproductive systems. And we have also what we call sex violence. Early sex or early practice of sex is not good, both to male and to female. We tend to get problems like whereby you enlarge your systems, you're not ready to get pregnant when you're still young. It affects you. Remember, when you have those sex practice at an early age, or sex violence, rape, defilement, you will get pregnant. The major problem that I've been discussing, we have what we call sex violence, or early practice of sex, defilement, rape, and other things, or malpractice of sex with different partners. So with this, it tends, 1, to enlarge your sexual organ, like the vagina. 2, it reduces on the strength or manpower. 2, getting pregnant at an early age. This affects you mentally, psychologically, and also it brings more problems. Like you can get a vaginal tear, a lot of issues with that. So we tend to discourage it. Reason being, it affects the reproductive system, and also the other parts like the pelvic, the uterus, all, they are not yet ready to conceive or to hold pregnancy. That's why we said that early sex violence or sex practices, they tend to affect the reproductive system. And we have mostly the main cause of most problems in reproductive health are the disease, or what we call sexually transmitted diseases, or the urinary tract infections. Under that topic, it is a bit large, but we are going to hold it slowly, that you will know, but with due time we will be able to talk about it. These STDs differs. When you keep on playing sex, you get infection or some diseases from that with due partners. You might be safe, but the more you have sex with different partners, you keep on getting, or you get infected, and you keep on spreading it. And the more you keep on spreading the disease, it also affects the reproductive system. For example, most urinary tract infections that we have, like the candida, the gonorrhea, trichomonas vaginalis, all those, they are sexually transmitted. So when you get them, they affect mostly all the organs of the reproductive system. We can say the candida affects the vaginal system, and also it can affect the other urinary system, because urinary system is also under, it's a part of, is connected to the reproductive system. You can get PIDs, what we call pelvic inflammatory disease, as secondary to this infection that are sexually transmitted, the gonorrhea. It can affect your manhood, it can affect the bladder, the cystitis, it can affect the kidneys, and then you get pyelonephritis. It can affect each and everything. It can also affect in one way that you can fail to conceive. So our advice is, make sure you practice safe sex. If not that, use other measures like the use of condom. You can also treat yourself as soon as you identify or you know that I'm sick. Whenever you know that you're sick, it is better you go to a medical facility and then you get a proper treatment after testing. That's why I recommend what we call test and treat, so that you can, and majorly, as I've outlined those are the major problems of the reproductive system. So in summary, I'm giving them to you. 1, we've said we have endometritis. 2, we have what we call gynecological or cancer. 3, we have what we call HIV/AIDS. 4, sex violence. 5, we have what we call the sexually transmitted diseases. 6, fibroids. And at first, in the other first topic, also we talked about of the infertility. It's also a concern that affects me too. And we said that we have cancers in men like prostate cancer, and also we have these other testosterone and so on. And thank you for tuning in. Thank you for being on our episode. This is Bisoboka Tonny. You're welcome. Health is wealth as usual. Keep protected and keep your life as a matter. Thank you.